Okay, this is like my 15th time recording this, but I'm lying. It's third or fourth. 15th, I would be dead. So I had an eval from Tufts Tufts. See, word finding. Oh, but I have no issues. Tufts Medicine Healthcare at Home. Home care at home. No, healthcare at home. I had palliatives from Southern, so I've been already approved for palliative care. They decided not to take me under for care, which is fine, except for how I found out. I found out from a note in my chart. It's one literally written on my birthday that says that the NP thinks that I can do more than I can. That I got up multiple times to get paperwork. And walked across the room. My printer is literally 3 to 4 feet away from my bed. I can pivot. I might have to take one step. On top of that, my visible registered heart rate's in the 100 to 120 range. So that disproves you're not taxing considerable effort. I also used my bed rail, okay, which was not documented. She said she saw no discomfort. How the hell are you assessing discomfort? And as a nurse, I understand that you can assess discomfort. I really do. But at the same time, in somebody who is being hyper-focused and is overexerting herself because she can already tell that you have bias and discriminatory thoughts about her based on your attitude when you came in. I can present differently, but that doesn't mean I was masking my freaking pain, which is probably not the best idea when you're getting palliative. I get that part. But I had my med nurse here. My aide was blocked off by the NP, who was giving nothing but a bitchy attitude out. So my aide couldn't even help me get the papers because she couldn't buy her. She already came in and said, we have 45 minutes. That's it. And had a terrible attitude. When she left, she said, well, there's a lot to deal with, but you'll be seen every 1 to 2 months. And that right there, because I was not told I was discharged. I was not told I was not taken for care until I saw that note in my chart that my doctor late documented. My doctor's very literal. I have zero doubt that she said those things. Oh, and that the PT had suspicions too. And when I brought that up to her, she said, oh no, I meant that the PT did an eval only and that you could do your home exercise program and work on functionality on your own. Yeah, which we agreed on because I've rehabbed myself multiple times. And right now there's not much they can do because I'm on spinal precautions for 6 more months. Again. Not only that, my autonomic doctor. So not only do I have my visible recording, which hopefully this time I record this, it records the freaking sound, and I can add it at the end if I make enough minutes left. That's still kind of cool. Not knowing you were discharged, if not a Board of Health complaint, is definitely a Medicare complaint. Now, Medicare for palliative is treated differently because it's a Part B benefit. But not knowing you were discharged is definitely something. And I'm just figuring this out as a quality person. So my background is home health for over 15 years, nursing for over 20, medical field for over 30. But a good portion of my home health career, other than when I did travel, And I mean, I wound palliative. I've done a lot of palliative, so I know what palliative is. I know since COVID, it's changed. In some places are doing more of a terminal diagnosis than a chronic disease affecting your quality of life diagnosis. But they didn't say that to me, or I would have or Joe, my case manager, or we would have never sent a referral over to them. So they need to teach their intake people to say they're only taking terminal patients then, which is not palliative care anyways. Sorry, word finding. There's no way she didn't see this. And the fact that I have trouble speaking, my vocal cord dysfunction is so fucked up from all the appointments, and probably a little bit of dystonia, cutting back on the diazepam, etc. And on top of that, just like talking in general. But I have shortness of breath with talking, so there's no way she didn't see that. I have trouble repositioning in bed. There's no way she didn't see that. She chose not to see it, is what happened. Because all of this has been documented. I'm tired of the medical PTSD and the medical betrayal as somebody who gave 20 plus years of my life to this field. Oh, and then she said, because I'm like, I just went through goals of care, just now trying to decide on neurosurgery. That'll be a different update. And she's like, well, see that you're smart enough to make the decision on your own. Okay. But I shouldn't have to. I should have support. And I should not have a judgmental, and I won't even use the word person, with bias and discrimination against certain diagnoses, either due to lack of education or because of when their education happened. These things were seen as psychological, and we now know that they're physiological. I don't know. And I don't even know if I want them. Like, I do. Because they're, I thought it would be better because they're attached to a recovery site. But you know what? It's the same thing with MGH. Even though they're trying to change that, a lot of MGH specialties don't believe in long COVID, even though Brigham Women's has a long COVID clinic and they're supposed to be MGB and all together. And don't get me wrong, they're trying to change that. But I'm just telling you. So I have neuroinflammation. I have inflammatory markers that show that when I overexert, my inflammatory markers go up. And that causes organ damage. I have freaking organ damage from long COVID. Documented organ damage. Oh, and then they're like, well, you have so many specialists, you don't need another one. Nobody is handling the palliative piece. The coordination of the symptom management. The coping and the grief and the quality of life discussions, and to when to say enough. And yes, I need to stay alive for my kids and my family right now, but there will be a time at some point I will need to say enough. And I need help making that decision because I have chronic SI, and I need to be sure that it's not that and not wanting to live this life anymore, and that it's actually time to make the decision. I have psychological help. I have wonderful counseling and case management. Carl, my health and wellness coach, who has helped me rehab multiple times, which is not his job because other people can't do the job. So I gotta decide what my next steps are. It will be based on what happens, based on my quality improvement complaint, and I'll go from there.